So it's 2 o'clock. I'm going to go ahead and call the meeting to order. We'll do a roll call vote, and I'll provide that. And then I'll go through some specifics for the meeting. So Member Sue, not present. Member Linden,
Present.
Member Dr. Wong,
Present.
and Member Garcia present. So we have a quorum. So good afternoon and welcome to the Ledge Reg Committee meeting. This meeting is available via teleconference. Individuals listening to the meeting will have an opportunity to provide public comment and will be assisted by the moderator who will be facilitating the teleconference process. For those members of the public participating via teleconference, please wait until the moderator has introduced you before you make your comments. Each person will be limited to 3 minutes per agenda item. The committee welcomes public comment on any item on the agenda, and it is the committee's intent to ask for public comment prior to taking action on any agenda item. If for some reason I forget to ask for public comment on the agenda item and you wish to speak on the item, please raise your hand and you will be recognized. Today's meeting will be run according to the Open Meetings Act as required by law. We plan to end today by 2 p.m. And I would like to introduce Executive Officer.
Sorry, Member Garcia, that's a typo in your script. It should say 4 p.m.
4 p.m. I'm sorry. Yeah, I'll be pretty fast by 4 p.m. EO Pruden, would you like to say a few words?
Yeah, just like to say good afternoon to the committee and any members of the public that are listening. Welcome and look forward to our meeting today.
Okay, thank you. So let's move to agenda item 2, public comment on items not on the agenda. Mr. Pruden and moderator.
Yeah, I'll start here by saying, again, my name is Greg Pruden. I'm the executive officer. I am located at the publicly noticed location, which is listed in the agenda for today's meeting. At that location where I am located, there are no members of the public present.
Thank you.
And my name is David. I'm the moderator. We are taking public comment for items not on the agenda via WebEx. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of your screen. Dial-in users dial *3 to raise a hand, and we will call on people in the order we have requests. As stated, you'll be given 3 minutes to speak, and I'll give you a 30-second warning before your time expires. We're going to take just a few seconds now to see if we have a request for public comment for items not on the agenda.
While we are waiting for that request, I would like to just make note to the members who are participating in this committee meeting today. We neglected to include on the agenda a future agenda item. So if any members of the committee have any agenda items not on the, have any items not on the agenda that they'd like to make a comment about, this would be the appropriate time to do so.
I don't have anything.
I don't have anything either.
All right, and this is the moderator. We still have no request for public comment. Would you like to continue with the agenda?
Yes, please. Okay, we'll move on to agenda item number 3, discussion and possible approval of April 21st, 2023 Ledge and Reg Committee draft meeting minutes. Are there any additions or corrections to the minutes from the members? If not, I'll accept a motion to accept the minutes as written.
I'll go ahead and make that motion.
Okay.
I'll accept to make a, do I have to make the motion or I can just?
I
I make a motion to accept the minutes from the April 21st, 2023 Ledge Reg meeting.
Okay.
I'll second that
We
motion.
have a first and a second. And now if we can open up for public comment.
Member Pruden, or excuse me, Executive Officer Pruden is in the publicly noticed location available on the agenda for today's meeting. There are no members of the public located where I am.
Thank you.
And we are open for public comment via WebEx. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of your screen. Dial-in users dial *3 to raise a hand, and we will call on people in the order we have requests. We're going to take just a few seconds to see if we have a request for comment on the motion. Seeing no request for comment, do you wish to continue with the motion?
Yes, please. Okay, we have a first and second. I'll take a roll call vote. Member Linden,
Aye.
Member Wong,
Aye.
and I vote aye. So motion passes. Minutes are accepted as written. We'll now move on to agenda item number 4. Discussion and possible action on.
Quick point of order, we should also include Member Sue as absent as we do the
Oh,
roll
okay.
call.
Thank you very much. Member Sue? Absent. So motion passes with roll call vote. Thank you. And now we'll move on to discussion item number 4, discussion and possible action on 2023-2024 legislation. EO Pruden, would you like to take this on?
Yeah, I'm going to take a big deep breath before I get started because I'm handling the next several items A through I. But before I get into the substance of the individual bills, I just want to say again that we have put together, staff has put together in your meeting materials a memo for this agenda item that includes not just the analyses and specific information for the bills, but also includes for the benefit of any newer committee members, information about just the legislative process and how the committee and overall the board engages in this process. So if at any point there are questions about that, happy to stop and take them. But I'm going to go ahead and get into the substance here now. So just to catch the committee up, new bills were introduced until February 21st of this year. We have been monitoring all of those bill introductions until that introduction date. This time, the bills that we have identified are included in the agenda for your consideration today. And so I'm going to go ahead and get started. Now, some of these I will go quickly through because this committee and board have already dealt with them and there have been no changes. They appear on our list because they are the bills that the committee and the board are watching or again have taken positions on. So the first bill is AB 1028. It's McKinnon Reporting of Crimes and Mandated Reporters. This is one of those bills that has had no subsequent action on it since the board last took its position. Just to remind this committee, the board's position on this bill is neutral, and this bill was introduced last year in 2023 and is currently being held on the Senate Appropriations suspense file. So we would not expect any future action on this bill to occur until later in the summer, if at all. But again, this bill is on our list because it's a bill that the committee has previously identified, taken a recommendation on, and again, the full board considered that recommendation and adopted a neutral position. So at this time, item 4A has no action necessary. I'm happy to take any questions on the bill, but if there are none, I will just keep moving on to our next bill. Just gonna pause for any questions, okay? The next bill we have on our list is AB 1570, which is by Assemblymember Lowe, Optometry, Certification to Perform Advanced Procedures. Much like the bill we just discussed, AB 1028, this bill was heard by this committee, was recommended to the board for a position, and the board adopted a position of support if amended. Those amendments had to do with implementation concerns, especially around the cost. Since our position was taken last year, this bill has died. What does that mean? It means that it is no longer eligible to be considered this year unless it is resuscitated at some point. So at this point in time, the bill is not active, it's not current, and there is no action that this committee or board needs to take on it. Again, we'll just pause for any questions before I move on to the next one. Okay, the next bill is AB 1991. Now, this is a new bill, a current bill, one that has not yet come before this committee. So I'm going to spend a little bit of time explaining what this bill would do. AB 1991 by BONTA, License and Registrant Records. The bill was amended on March 11th and has been referred to the Committee on Business and Professions. We don't yet know the author reason for this bill, although we can certainly guess at what that reason would be. And let me say a little bit more about that. So currently, our board, the Board of Optometry, and all other healing arts boards in the Department of Consumer Affairs are required to collect or ask for workforce data from licensees and registrants. And we principally accomplish this work by asking for this information at the time of renewal. Optometry and optician licensees are renewed every 2 years. So on their renewal application, 14 different workforce questions are presently asked. These questions involve traditional, more demographic categories such as gender, race, language spoken, sexual orientation, but asks for information such as when do you expect to retire, where you're practicing in terms of location, your education background, so on and so forth. As I just mentioned, these 14 data elements are required to be asked by the boards, but they are not required to be answered by the renewing licensee. The questions are optional. So presently, all licensees are able to select decline to state to any or all of these questions and proceed with their renewal application without answering these questions. The Department of Healthcare Access and Innovation, HCI, publishes this workforce data in a variety of different data sets and dashboards. In your material, in your analysis for this bill, we've included a link to that workforce data. Presently, HCI only displays workforce data for optometrists. They do not, on their dashboard, display workforce data for the opticians at the moment, although we anticipate that information will be coming hopefully soon. So what would this bill do? This bill now changes the optional answering of these questions to required. That is the principal impact of this bill. We don't anticipate from a board perspective there really being any fiscal or other implementation impacts to us specifically. All healing arts boards in DCA on their applications for renewal have to ask these questions. And again, as I stated, there is the ability to decline to answer any one or all of them. In talking with DCA, DCA would likely have to change the business process for all of these applications to make the questions required to be answered instead of optional. The larger impact that we would anticipate would probably be on the licensee. We sometimes get questions or comments from licensees who are concerned about providing this information or not happy about why it is being asked. And we are able to deal with those questions by just reminding them that by law, we are required to ask these questions, and by law, they are not required to answer them. Under this bill, again, it would change that situation such that the questions would have to be answered, and we would likely expect renewing licensees or the frequency of renewing licensees submitting comments or asking questions of our staff about why they have to do this, or otherwise being upset about having to do it, to increase should this bill become law. The committee recommendation that from the staff perspective would be neutral, and the reason why we say neutral is to continue to see how this bill sort of unfolds. You may have picked up on the fact that I mentioned only the healing arts boards in DCA are required to collect, required to ask for this information. None of the non-healing arts boards, such as contractor state license board is one example, have to ask this information. So we're suggesting a neutral because there have been some conversation around the department about why it is that healing arts has to and non-healing arts doesn't. And is there any opportunity to look at workforce data for the non-healing arts board? So at this point, that would be our staff recommendation, but happy to listen to the discussion and answer any questions that the committee members may have.
Yeah, Greg, this is Member Garcia. You may have mentioned, but do you know why healing arts was singled out on this particular bill?
Well, so again, originally it has long been the case that healing arts has to ask this information, but it's not required to be answered. I believe the original intention or reason for that was because in certain healing arts certain healing arts. Think of nursing, physicians are probably the two best examples. There have long been discussions and conversations about whether there are workforce shortages or not. Do we have underserved areas? Do we have nurse staffing shortages? Do we have primary care physician shortages? So on and so forth. And so it's my understanding that that's the reason, original reason why this information was required to be asked in the first place.
Thank you.
Okay. This is Member Linden. Yeah, I feel like I could see how it could be more important to get some of this information just to think about healthcare workforce issues and for the state to try to plan for the future and make sure, you know, that there's enough healthcare providers out there. If that is the need, though, trying to understand where potential pipeline issues could be or health workforce shortages could be, you know, I do understand that having, you know, culturally competent care is also part of making sure you have a workforce that can serve everyone. But I can also see how maybe some people might really not want to answer questions that are so personal to them. And so I wonder if there'd, you know, possibly be any way to kind of parse out information that's really about, you know, health workforce and where the issues are versus, you know, personal information that people just might really not want to share.
I think those questions are probably, they're great questions for sure, right? But I think HCI would probably be the better entity to take them.
Mm-hmm.
This is all driven from them,
Mm-hmm.
right? This is data that DCA collects on behalf of not just this board, but all of the other healing arts boards, and then is provided over to HCI. And they've done a lot of work the last couple of years, propping up that dashboard that we've linked in our materials for this item, and a lot of other initiatives that they're involved in around the workforce question, not just race and ethnicity and those sorts of questions. So whether there are in fact shortages, either statewide or regional. And so I'm not sure what opportunity we as an individual board, or frankly, even, you know, a department have to make a lot of changes here. This is really HCI. You know, I've been part of meetings at the staff level with the other healing arts boards, not talking about this bill, but just about the dashboard and the data that they display and so on and so forth. You know, personally in my role as the executive officer of this board, I'm asking them, why don't they yet have the optician data up there? You collect it, you've got our optometrist data displayed, you don't yet have our optician data. So I'm asking them questions about that. There are other programs that have similar situations where data is collected, yet the dashboard doesn't display their information. So we've been focusing more of our efforts on sort of that aspect of it, and less about the collection of the data, because we don't analyze that. We don't otherwise look at that. It goes over to HCI and they deal with it.
Mm-hmm. Oh, thank you.
So we have options here as a committee. We can certainly do nothing and just keep watching it. We can support the bill. We could obviously recommend an oppose, although that would not be what I would advise you all to do. But that's certainly in this committee's purview to make any recommendation it so wishes to the full board. Again, as I stated, we thought neutral at the time for now be appropriate, because there's sort of conversations happening around this bill about, again, why is some of the data that you already collect not part of this dashboard? We'd really love to see that happen. The non-healing programs that also have workforce questions and curiosities who are not part of this are also wondering about those questions. So there could be future changes on this bill, which is why we were suggesting a neutral.
I think that makes sense.
I agree. I'll make the motion. I'll make the motion that the California State Board of Optometry remains neutral on AB 1991.
Okay, do we have a second?
I will second that.
Okay, we have a first and a second. At this point, I'll open it up for public comment.
Executive Officer Pruden is located at the publicly noticed location in the meeting agenda. There are no members of the public located where I am.
Thank you.
And for our online folks, now is the time to raise your hand if you'd like to make a comment. Please tap that hand button at the bottom of your screen. Dial-in users, dial *3 to raise a hand, and we will call on people in the order we have requests. We're going to take just a few seconds now to see if we have a request for public comment. Seeing no request for comment, do you wish to continue?
Yes, please. Okay, we have first and second, so I'll take a roll call vote to maintain a neutral position on AB 1991. Member Sue? Not present. Member Linden?
Aye.
Member Wong?
Aye.
And Member Garcia, I vote aye, so motion passes. We'll move on to item D.
Very good. Item D is AB 2327 by Assemblymember Wendy Carrillo. Title of the bill is Optometry, Mobile Optometric Offices Regulations. A quick note on this one that the bill, subsequent to our materials being put together, the bill has received an amendment. And so the version of the bill that you have in your packet is technically out of date as of just a couple days ago. So I just wanted to mention that. But let's get into this bill. AB 2327. The reason for the bill, according to the author, is to expand mobile optometric office care. Presently, the provision in law that authorizes the mobile optometric office program has a sunset date of July 1st, 2025. The present law also required this board to promulgate the regulations by January 1st of 2023. So this bill has been introduced to extend out both of those dates. The bill proposes to now sunset the mobile office program on July 1st, 2035. So it is proposing to give a 10-year sunset extension to the program. It also extends out the due date for the board to promulgate the regulations from Jan 1 of 2023 until January 1st of 2026. The amendment that was received a few days ago has to do with the safe harbor provision that presently exists in the law. So under the law currently, the board is prohibited from taking action and enforcement action on mobile office optometric providers who are affiliated with a school until such time as the regulations are in effect. The amendment slightly amends that safe harbor provision to say no action can be taken by the board until January 1, 2026, or when the regulations are promulgated, whichever occurs first. So a little bit of background for this committee. The mobile office optometric program was originally established by AB 896 back in 2020. It became effective on September 24th, 2020, because it had an urgency clause. That the law that was created by that bill was Business and Professions Code Section 3070.2, and it was subsequently amended the next year via AB 1534. It was AB 1534 that provided the board until January 1, 2023 to promulgate the regulations. While the board did not meet that original due date of Jan 1, 2023, the regulations for the mobile office optometric program have been noticed. They were noticed on February 23rd of this year for a 45-day public comment period, which ends on Tuesday, April 9th, just next week. So as I mentioned, this bill extends the sunset date out 10 years. It gives the board until January 26th to promulgate these regulations. Those are the two principal impacts of this bill. We don't anticipate any fiscal associated with this because this bill is just proposing to extend out a program that already exists, and the fiscal impact was realized by the original authorizing legislation. We do recommend that this committee have a support position extending the MOVE program out 10 years as a sufficient amount of time in terms of a sunset to allow for a program to exist and enough data to be acquired to help inform whether or not the program should be allowed to continue. In your meeting packet, you have both a copy of the bill text and a copy of the Assembly Business and Professions Committee analysis from just about a week ago. Happy to entertain questions or comments from the committee on AB 2327.
No comments.
No comment? Yeah, no comment myself either. Very good explanations, very clear. Thank you.
Yeah, thank you.
Staff recommendation was for support, when we would certainly entertain that as a motion from the committee.
Would someone like to motion?
I'll move to support the committee recommendation
Okay.
of support.
And
And I will second it.
okay, we have a first and a second. Let's open it up for public comment.
Executive Officer Pruden is at the publicly noticed location available in the agenda for today's meeting. There are no members of the public located where I am.
Thank you.
And for our online folks, now is the time to raise a hand by tapping that hand button at the bottom of the screen if you'd like to make a comment. Dial in users dial *3 to raise a hand, and we will call on people in the order we have requests. We're going to take just a few seconds to see if we have a request for public comment. Seeing no request for public comment, do you wish to continue with the motion?
Yes, please. Okay, so we have a first and a second to support AB 2327. I will now take a roll call vote. Member Sue? Not present. Member Linden?
Aye.
Member Wong?
Aye.
And Member Garcia, I vote aye. So motion passes in support.
Good.
Yep, Pruden.
Very good. We'll move on to the next bill, which is item E, AB 3137 by Flora, Department of Consumer Affairs. This one's going to be real easy breezy because this is what we call a spot bill, meaning it is a bill that has no substantive effect. You may be wondering why we included it, therefore, on your agenda for today. The reason why is because bills are living, breathing entities, if you will, and amendments can happen frequent and often. And so we've identified this bill as having the possibility of either impacting the board or the department itself. Although, as I just stated, at this time, there are no specific impacts. So there is no committee, there's no staff recommendation, there's no committee action needed at this point, and we can skip over it until such time as there are some real impacts to it. Moving on to the next bill, which is SB 340 by Eggman, Medi-Cal Eyeglasses Prison Industry Authority. Much like AB 1028 and AB 1570 that we've already discussed today, SB 340 is a bill that this committee had an extensive conversation about last year. We continued that conversation at the full board, and we have a support position on SB 340. Since our support position, this bill has essentially had the brakes put on it. It has run into some issues with the Department of Healthcare Services and the Prison Industry Authority, who are also impacted by this bill. The last communication that we had on this bill with the staff, with the author's office, was that this bill was likely to be amended in 2024 to have a much narrower attempt at the issue, given the concerns expressed by Healthcare Services and the Prison Industry Authority. We have not yet seen those amendments, and so at this point in time, there is no action requested by the committee until we see that the bill has been amended. Any comments, questions about SB 340 at this time?
None for myself.
No.
Okay.
None for me either.
We will move on then to item G, SB 13 by Senator Grove, serious felonies. This bill's a little interesting because technically is what we call a spot bill. Again, as I just mentioned, with 3137, a spot bill is a bill that really has no changes. So you may be wondering why we're talking about this one and analysis has so much detail in it. The reason why is because of the topic, serious felonies. So under present law, in Business and Professions Code Section 480, applicants or licensees that have criminal convictions, we have to investigate. We investigate every single criminal conviction, and we are looking for whether it is substantially related or not to the functions and duties of an optometrist or an optician. Existing law found at Penal Code Section 1192.7 provides a definition of serious felony, including a list of about 43 different crimes that are considered serious felonies. There have been claims by some that that list misses certain crimes that should be included as a serious felony. Last year, Senator Grove had a similar bill that attempted to add a child trafficking of a specific nature to the definition of serious felony found at the Penal Code Section 1192.7. We anticipate that Senator Grove is making a similar attempt this year. We don't yet know what specific law or, crime or crimes she intends to add to this definition. But we wanted to provide some information to this committee about what the board's current process is for folks that have criminal convictions or past disciplinary action. Your packet includes a link to the FAQ that the board has published for applicants, members of the public, licensees to look over should they have any questions about criminal convictions or disciplinary information. So at this time, we are recommending a watch, given that we are anticipating future amendments, but wanted to put some of the detail behind the issue, the topic, so that the committee would be able to better understand what this bill is going after. Happy to take questions, comments from the committee at this time.
Nothing for myself.
Yep, no comments here.
Yeah, same.
We will continue watching it, keep bringing it back to future committees and board meetings as this bill, if this bill is changed and receives future amendments. Okay, moving on to item H, which is SB 1468 by Ochoa Bowe and Roth, Healing Arts Board's informational and educational materials for prescribers of narcotics, federal 3-day rule. Not sure exactly what the author's purpose for this bill is, but given the topic and what it's dealing with, we expect it has to do with spreading awareness over a revised federal 3-day regulation that has to do with opioid use disorder and the medications used to treat it. Now, this bill would require our board, the medical board, the dental board, the podiatric medical board, the veterinary medical board, the board of naturopathic medicine, the physician assistant board, and the board of registered nursing to develop and biannually disseminate to each licensee informational and educational material regarding the 3-day rule. You may be wondering what the 3-day rule is. In your materials, we have some background and information about that federal rule. Essentially what it is up until recently, August of last year from staff's research, the federal 3-day rule meant that a prescriber could provide not more than 1 day's medication for a person at one time, and it could be provided for not more than 3 days, could not be renewed or extended. What this meant was that people who showed up at the emergency room, for example, suffering from an opioid use disorder, would be given 1 day's worth of medication. They would leave. They may experience an event that requires them to have more medication. Under the old 3-day rule, they had to go back to the emergency room to acquire that second day and then go back a third time to get the third day of medication. That all changed pursuant to a federal regulation last August, and now you can give a 3-day supply of these drugs at one time. Now, it's staff's belief that optometrists don't have the authority to prescribe the drug that we're talking about, which is buprenorphine. Optometrists in California have fairly limited controlled substance authority, really just limited to codeine, hydrocodone, and tramadol, limited to 3 days, with a requirement to refer to an ophthalmologist if pain persists. So a very limited prescribing controlled substance authority exists for optometrists in California. However, the bill's definition of prescriber includes optometrists. We, the board, would be required to develop and disseminate the pamphlet of educational materials that the bill is speaking about. While it may be the case that optometrists are not able to prescribe buprenorphine or may not otherwise find themselves in a setting or a situation where it is used, prescribed, dispensed, so on and so forth. Optometrists do work in hospitals, facilities, health facilities, clinics, so on and so forth, where patients or people may present suffering an opioid use disorder. And as a controlled substance licensee with that authority, it would be important for optometrists to be aware of the education around this topic. So that's how staff is seeing this bill at the moment. We are recommending a watch at this time because we feel like there's a little bit more research that we need to do around this question of buprenorphine and optometrists' ability to either dispense it if they find themselves in a situation where somebody is suffering an emergency, so on and so forth. So the recommendation at this time is watch, but happy to entertain questions, comments from the committee, especially the licensee members that may have more experience with this issue.
And nothing from myself.
No comments here.
Okay.
I would say in terms of, if this bill continues to move and optometry board would be required to come up with some pamphlet or something like that, I would anticipate, because there are so many boards involved that, and there's only one federal 3-day rule. It's not like there's different rules for different prescribers here, that it would probably be the case that DCA would assist boards that are impacted in producing and disseminating this material. We would probably work very closely with medical board, who has a larger impact here, to make sure that any materials are consistent, similar, that our board is not putting something out there that is very different than what other boards may be putting out. So more to come on this topic as it evolves.
Mm-hmm. Do you anticipate it? Because it seems like they cast a pretty wide net in terms of just, in terms of all of the different boards that would be required to do this. So do you anticipate that they, like the authors, might kind of narrow down who this would apply to as well?
Yeah, I mean, that's possible, right? And that was something that I thought about and considering, what to recommend to this committee. I think at one point we were thinking, should we try to explore some sort of amendment to get optometry out of the bill?
Like the vet board is included, like.
Right.
Yeah.
Well, I hope that the vet board, I hope veterinarians are not, given medications to there should only be given to non-human animals, not human animals. But you're right. Their licensees also have controlled substance authority, and they're not mentioned. So yeah, I think initially that's sort of where I was thinking about this was, does it even make sense for optometry to be included, especially if it's true that optometrists don't have buprenorphine controlled substance authority?
Yeah.
However, again, the fact is that our licensees do have controlled substance authority, albeit limited, and they may find themselves in a situation where somebody is presenting themselves suffering. And and we would want our optometrists to have the knowledge and the education, you know, at their fingertips, if you will, to be able to better deal with those situations. So for those reasons, you know, it probably makes sense for the optometry board to be included and be part of this. As I was saying earlier, I don't think our board would be wanting to lead any effort about designing this pamphlet. We would very much be looking to our partners and friends at the medical board and the other boards who have prescribers with, you know, a more expansive controlled substance authority, assistance and help in designing a pamphlet. You know, would love to borrow liberally from anything that they put together to share with our licensees. So it's a tough one because, again, you know, optometrists don't have buprenorphine prescribing authority, but they might find themselves in an employment setting where opioid use disorder patients may be presenting.
Also, just for some additional context, so the definition they're referencing comes from the Uniform Controlled Substance Act, and which lays out what basically any person who can prescribe a prescriber is allowed to do. And in a very simplistic form, it essentially states that the prescriber can prescribe controlled substances, like based off of their reasonable belief that's necessary to treat a disease within the scope of practice. That doesn't necessarily address all the prescriptions for individuals who are on opioids or like addicted. There's a whole separate section within the act for that too. But my guess is that's why they also reference the definition there.
Thank you.
So we'll keep watching this bill and see how it may evolve and change over time. And happy to move on to the next one if folks are ready.
Yep, sounds good.
Move on.
All right. Well, this one's going to be an easy one because item I, SB 1485 by Gonzalez, Consumer Complaints, is also a spot bill. We put it on here because it could have the, based off of the potential topic, consumer complaints, and it names the Director of Consumer Affairs. We are anticipating future amendments that may impact the board and or the department, but at this time, there are no amendments, so we will continue watching this bill and bring this bill back to this committee should there be amendments that impact either us or the department.
Thank you.
And with that's item 4.
That was a lot. Prudent, thank you for the great background and description of all these bills. And again, thank you to the staff because it was a lot of work, I'm sure, to get all this information compiled for this meeting. So thank you all.
Happy to do it. Thank you.
And I really particularly like the information on bills and how they progress. I think that would be nice to share with the entire board to get that background. It can be confusing to know the path of a bill and how they originate and all the steps.
Sure, Garcia, are you referring to the information at the beginning part of the
Correct.
item?
Yes.
Sort of how a bill becomes a law and all that?
Yeah. It's kind of like that old I'm a Bill on Capitol Hill thing, the cartoon.
Oh, don't make me sing it. You don't want that.
That's what it reminded me of, but it's very helpful. Even for me to reread that, but I think for the whole board, it would be nice to have that background information.
Yeah, I appreciate that feedback. I think especially as our board has changed so much in the last year in terms of our new members and so on and so forth, it probably would make sense. Council's probably gonna get mad at me what I'm about to say here, but it probably would make sense for us to have at the full board a larger discussion about the process, the legislative process, how a bill becomes a law. But I probably need to stop there because we're talking about a future agenda item that I shouldn't be talking about.
Sure.
So.
Thank you. Okay, so that takes us to our last item, which is number 5. Unless there are any other comments from the committee. Nope, hearing none. So we will adjourn. So thank you, everybody.
Let me get public comment on those items.
On which
Thank-
ones? On
I
all,
forgot to get public comment. Yeah.
on all of the items of
Yeah, just as a whole.
the bills?
Yeah.
Okay, so now let's open up for a public comment for all the bills that were discussed. So if we can take the public comment from EO Prudent and also from the phones.
Yeah, EO Prudent here at the physical location publicly noticed in the agenda. There are no members located where I am.
Thank you.
And for our folks online, now is the time to raise a hand if you'd like to make a comment on all of agenda item 4. Tap that hand button at the bottom of your screen, and for our dial-in users, dial *3 to raise a hand. And we will call on people in the order we have requests. We're going to take just a few seconds to see if we have a request for public comment. Seeing no request for public comment, do you wish to continue with the agenda?
Yes, please. Okay, moving on to item number 5. I want to thank everyone for their participation today on the Ledge Reg Committee, and we will now adjourn the meeting at 2:46. Thank you, everybody.
Thanks.
Thank you.
You know.
Thank you.
Bye-bye.